We could have had so much more time, and it was taken away.
We discovered a company making hundreds of millions of dollars a year off cutting care to America's sick and elderly.
They did not take him to the hospital. They did not call a paramedic. They basically just put him back in the bed.
Now we're sitting here, she's got 2 above-the-knee amputations of her legs. She's got no legs.
Their decision was to cut the staffing levels to make it more profitable. We think that's a problem.
So the Ensign group is where I have an issue.
We could talk about standards, but it's all a sideshow. It's all the money.
Thomas Gates was a preacher, a father, a grandfather.
This man that was larger than life to me.
When he was diagnosed with throat cancer, he went to a nursing facility operated by Ensign, the largest chain in America.
He went to Ensign Group and his health started declining. They were understaffed. Even his fall incident, he had tried calling a nurse and nobody came. I could tell that my children were about to lose their grandfather who they loved so much and who was such a big part of their lives as well.
Ensign says their customers come second because their staff comes first. We found it's actually profit that comes first. Staff is stretched past the breaking point and patients are an afterthought. We spent months investigating the Ensign Group. What did we find? A multi-billion-dollar company that enriches itself by cutting costs on critical nursing staff. Dozens of patients neglected and others brutally hurt. Some even die.
We see the worst of the worst. We have typically alleged that their care does not meet the standards that you would expect of a nursing home of their quality and caliber. We deal with patients who have been injured, usually seriously, often killed by the negligence of these facilities. Our allegations are very often that these are systematic failures.
On paper, Ensign looks great. Its facilities score above the national average on the quality metric many families use to choose a nursing home. But that metric is largely based on self-reported data. A different picture emerged when we turned to the numbers verified by outside inspectors and audited by government agencies. Take the example of Misty Willow, an Ensign nursing home in Texas. 4 stars on quality measures, self-assessed and self-reported. Staffing rating, 1 star. That's an auditable metric. Health inspection rating, 1 star again. Those are conducted by federal and state agencies. Falls are self-reported, according to CMS's own ratings guide.
If they could deem that something was truly not a fall, then that's the way they report it.
Multiple former employees told Hunterbrook Media that staff would underreport or reclassify falls and inflate treatment minutes in their reporting.
If we saw somebody for 30 minutes, when it got to the next level, the 30 would be erased and somebody would put in a 70.
You are incentivized to find as much shit wrong with the patient as possible and then bill for it when treated.
Federal law says nursing homes have to have sufficient staff to meet the needs of their residents. But what does sufficient actually mean? Researchers have calculated how many hours of hands-on care different medical conditions require, literally timing it down to the minute. We used their research to compare what Ensign residents actually need versus what they're getting, and the gap is massive. Ensign facilities fell short by over 5 million hours over just a 5-month period. If you put that in dollar terms, that's $161 million for hours of care never provided.
They're being paid to staff up here. This is acute. And they staff way down here.
If they're not spending money on paying people to be there, then they're putting money in their pocket.
Our research suggests that when Ensign acquires a nursing home, a pattern emerges. They take on sicker resident populations, then staffing goes down. Ensign's own filings say they focus on high acuity patients. Medicare pays more for sicker patients, but our investigation shows the money doesn't always go to patient care.
The regulation is that you have to staff to meet the needs of the residents, and that consistently does not happen.
And I think it is fraudulent to not produce the staffing that the residents need.
So where does the money go? In 2024, $339 million in revenue flowed from Ensign nursing homes to related parties. That's companies Ensign itself owns or controls. Management fees, insurance through Ensign's own captive insurer, real estate through subsidiaries.
What they did wasn't just neglect, it was abuse, because they made a conscious decision to take money that was supposed to be for your care and put it in their own pockets.
These are the dying moments of Jacob Foss. A lawsuit alleges he died after nurses neglected him. At the Ensign nursing home where he lived, the manager's bonus was tied to profits after expenses. So by cost cutting, he was able to double his pay from about $400,000 to more than $800,000, according to court records.
It's just corporate greed, and to an extent that people just don't get. Just the absolute horror that these folks go through. Dehumanization. It's inexcusable and offensive.
I am a broken person now, and I watch many people in here get broken.
Cheryl Weir was a mother of 7, a grandmother, a great-grandmother. She spent her final days at Sunview, an Ensign facility.
That evening, when they weren't responding, they were both banging on the walls to try and get somebody to cut in there to respond to the fact that my mom was struggling, that she needed to be hooked back up to the vent, and no one responded.
How long do you think she and Eva were there struggling to get someone's attention?
I don't know. I mean, obviously long enough that made the difference between life and death.
I couldn't breathe no more. And she wrote a note, I need help. By the time she came in, too late.
We could have had so much more time. And it was taken away. Because I really think she would have been able to get home. And their lack of care ended that for her.